multiple adjustments I've already mentioned that pertain to the elimination of the Mental Health and Substance Use Task Force Reserve Fund. Turning over to page C83, this is the Opioid Abatement Fund. The next couple pages contain directed grants to various nonprofits, local governments, including LME MCOs. The total of these directed grants that use opioid settlement funds as the funding source, you can see in item 137. So they total $31.35 million in the first year, $6.75 million in the second year. Unless the chair really wants me to, I will not read each of those to you.
The next division is public health, and we can start on page C96. Item 185 is a $150,000 non-recurring directed grant to Sound Rivers. On page C97, item 188 is a block grant adjustment. Item 189 is additional funding to local health departments for their general aid to counties agreement addendum. And again, this was from the cut in child and family well-being to nurse-family partnership. Item C98 at the top are two medical examiner system items. Item 191 increases the fee paid to local medical examiners from $200 to $400. And item 192 provides funding for 2 new forensic pathologists. On C99 at the top of the page, item 195 budgets receipts from an increase in the DWI revocation fee. Item 197 is an funding offset for maternal and infant health initiatives using receipts from the Johnson & Johnson talcum powder settlement. This does not change total funding for maternal and infant health. It remains at $65.6 million in each year of the biennium. Item 198 is a reduction to the recurring funds that Carolina Pregnancy Care Fellowship receives. There is $6 million remaining in the base budget to that organization. C100 are several block grant items along with C101. Moving to C102, this is Public Health Special Fund. This is a base budget adjustment that converts a time-limited recurring position to a time-limited position, as the funds are federal funds and will expire at the end of 2026. Item C103 budgets additional receipts in the Youth Electronic Nicotine Abatement Fund. This is from the Juul settlement. These receipts are budgeted, but they are not appropriated for use at this time. And that concludes public health. Moving on to services for the blind, deaf, and hard of hearing. The only items are on C110 is a block grant item.
So then moving on to page C117, we'll finish out with the Division of Social Services. So again, on page C117, the first item there, number 215, is a one-time reduction just in the first year to the operations and maintenance funding for the county administration reimbursement system. So this is an IT system that is currently being developed and has not yet been developed, so the operations and maintenance funding won't be needed for the first year. Flipping over then a couple pages to C119. At the top there, item 220 is a similar scenario. It's a one-time reduction to the operations and maintenance funding for the Child Support Services IT system at $750,000. Again, just the first year. Once again, this is a system that is currently being modernized, and the operations and maintenance funding are not yet anticipated to be needed. In the Low-Income Energy Assistance Program Budget Fund, item 221 is a technical adjustment, and then items 222 to item 229 in the next page are all block grant items. I'll just quickly note that these are all reductions because the federal government is providing less funding in this block grant to the tune of around $18 million than previous. So these changes are just reflecting that reduced availability. I'll also note that if you compare this section to the Senate's budget proposal, the adjustments are different just because for this House budget, the starting point was updated to new numbers. So although the Senate and the House adjustments are both funding at the same level, the adjustments on the reports appear differently just due to different starting points. Moving on to page C121, I'll just mention that those are block grant items, and then flipping over to page C123 also contains just block grant items. So then skipping over to page C124, at the top there, we have items 240 and 241, which are reflecting reductions, or 240 is reflecting reductions to the special assistance budget due to a surplus projected in this upcoming biennium in this program. So this is not affecting the program in terms of benefits or people receiving assistance. It's simply reducing that budget surplus. And item 241 is a technical correction just to bring the receipts in line as they should be. At the bottom of that page, items 243, that's a one-time directed grant of $5 million to Boys and Girls Clubs throughout the state. And then item 244 and item 245 on the next page, these are both directed grants, $2.5 million in the first year only to Second Harvest Food Bank, just in 2 different locations. And Mr. Chair, that concludes our summary of the committee report. If you'd like, we will now be moving on to the special provisions packet.
We will in a moment. There will be time for questions after we go through the special provisions. I failed to mention my good friend Senator Bergen is here. He come to see all the great things we did to the budget that they sent over. And we're looking, the 3 of us are looking forward to working with him again when we all sit down and put our minds together and adopt the House budget. So we certainly appreciate you being here, and you're always welcome in the House meeting, Senator. My next 2, this is my favorite part of the whole meeting here with Ms. Wilkes and Allison and Joyce. They've been working on this presentation all night, and the area that Mark took over to run over on the time limit, they're promised that they'd make up. So Ms. Wilkes or Mrs. Jones or Ms. Rossi, you're recognized.
Good morning, chairs and members of the committee. My name is Joyce Jones. I'm the Health and Human Services team lead for the Legislative Drafting Division, and my capable colleagues, Lisa Wilkes and Allison Rossi, will help me walk through the provisions. Before we get started, I just want to explain that the special provisions are the legal language that help to implement the General Assembly's directions for the Health and Human Services part of the budget. And it may be helpful for you to know that we have included markings on the various provisions. You'll see different codes in the upper right-hand corner of each provision. BP means that is a provision that is boilerplate and has appeared in the special provisions for Health and Human Services for quite a number of years. They're typically the belts and suspenders of programs or initiatives. You'll see a capital S if that provision appeared in the Senate budget. You'll see a capital S with a small m if that provision is a modified version of what appeared in the Senate budget. You'll see a capital F with a $sign if it's a provision that follows money. And then lastly, you will see identified in the upper right-hand corner the bill numbers if the provision is identical or similar to a bill number. And with that being said, please turn over to page 1, which will begin the Division of Central Management and Support. Section 9B.1, reports by non-state entities on the use of directed grant funds. This provision requires the Department of Health and Human Services to submit all reports received from non-state entities on the use of their directed grant funds to the Health and Human Services Oversight Committee and the Fiscal Research Division by November 1 of each year of the fiscal biennium. And this provision appears in the Senate budget. On page 2, the Community Health Grant Program. This is a boilerplate provision that also appears in the Senate budget. It sets forth the requirements, limitations, and reporting for the Community Health Grant Program. The boilerplate caps single grant awards at $150,000 and authorizes the Office of Rural Health to use up to $200,000 of program funds each year of the fiscal biennium for administrative purposes. It also directs the Office of Rural Health to report to HHS oversight on program outcomes by September 1 of each year. On page 3, Section 9B.4, the clarification related to expansion of the North Carolina loan repayment program. This provision follows money and was also included in the Senate budget. It's a clarification related to an expansion of the North Carolina loan repayment program that was funded in your 2023 budget with ARPA temporary savings fund money. It establishes a $50,000 cap on awards of loan repayment incentives for each eligible behavioral health provider, registered nurse, and clinical nurse specialist that participates in one of the new initiatives designed to address these professional workforce shortage areas in rural and underserved areas. On page 4 is a House-only provision. This provision is expanding and renaming the Rural Healthcare Stabilization Program, which was enacted in 2019, to provide below-market interest rate loans to support financially distressed hospitals located in Tier 1 or Tier 2 areas of the state. To receive an award under the current program, hospitals have to demonstrate their inability to sustain operations for more than 3 years from the date of their loan application, and the local government commission must approve the loan. Loan proceeds must be used to help the hospitals transition to more sustainable, efficient, and proportionately sized healthcare service models in their communities. This provision would amend the program to expand eligibility to include any North Carolina healthcare facility located in a Tier 1 or Tier 2 area, and to transfer program administration responsibilities from UNC Healthcare to the Office of Rural Health. The Office of Rural Health would be authorized to enter into a contract with a nonprofit organization to serve as the program administrator, and the program administrator duties are laid out in Section 131A, 31 sub B, starting on page 5, line 15. Among the program administrator's most important duties are the development and periodic updating of a statewide rural healthcare sustainability plan, utilizing effective models of healthcare for the state's rural communities, and the evaluation of loan applications and proposed projects developed by applicants seeking loan awards to determine if the projects are financially feasible and align with the statewide plan. The program administrator also makes recommendations to the LGC about loan applications, but the local government commission makes the final determination about loan awards. And then finally, I'll point out that there is an existing fund to cover the cost of loan awards under the program. The provision would allow the Office of Rural Health to expend up to 3% of the monies available in the fund to reimburse the program administrator for administrative costs and expenses incurred in assisting with program administration. And if you look on sub B, starting on page 8, line 13, the provision sets forth several requirements and limitations that will apply if the Office of Rural Health elects to contract with a nonprofit organization to administer the program, and those requirements are meant to protect the state of North Carolina. Turning to page 12, section 9B.5, management flexibility for the department to expend certain ARPA temporary savings fund appropriations. This follows money in the 2023 budget and also appears in the Senate budget. It reauthorizes the management flexibility given to the department in your 2023 budget for purposes related to child and family well-being. It allows the department flexibility in allocating any unexpended funds remaining from that pot of money that was appropriated in 2023 to the Division of Child and Family Well-Being, the Division of Mental Health, and the Division of Social Services in the amounts and for the programs and initiatives the department deems necessary, as long as those programs and initiatives are consistent with the original purposes described in your 2023 budget. On page 13, management flexibility regarding mandatory vacant position eliminations. This provision follows your money, and it's a House-only provision. It directs the department to achieve net general fund savings of $10 million in recurring funds for each year of the fiscal biennium through the elimination of vacant positions, and with respect to the $10 million only, it gives the department flexibility to eliminate any vacant positions except those under the Division of Aging and Adult Services, the Division of Public Health, or the Division of State-Operated Healthcare Facilities. Page 14 follows your money. This is a House-only provision. This provision is eliminating the Office of Health Equity and repealing an obsolete reference in the general statutes to the Office of Minority Health and Health Disparities, which was the prior name of the Office of Health Equity. On page 15, expansion of lapsed salary reports provided by the department to the Joint Legislative Oversight Committee on Health and Human Services. This is a House-only provision that adds an additional category of required information for the department to include in its annual lapsed salary report to HHS Oversight. Per the new subdivision 5, the department must report the amount of any lapsed salary funds it expends, broken down by the original source of funds, which is defined as either the general fund, federal funds, or departmental receipts that are not federal funds. On page 16, the transitions to community living funding, priority distribution of housing slots. This provision follows money and is only included in the House budget. It requires that the $12 million appropriated to the department for the United States Department of Justice 2012 settlement agreement be used to meet the unmet requirements of that agreement. It also instructs the department to cap the number of housing slots in the supportive housing program at the number of individuals being served or approved to serve on the date this section becomes law. And that concludes the Division of Central Management and Support. I'll turn it over to my colleague, Lisa Wilkes, for the Division of Child Development and Early Education.
Thank you, Joyce. Again, Lisa Wilkes, Bill Drafting. On page 17 begins the Division of Child Development and Early Education provisions. On page 17, this provision is a boilerplate provision, and it's the NC Pre-K programs standards for 4- and 5-star rated facilities. This provision sets forth the eligibility requirements, criteria, and standards in administering the NC Pre-K program. Moving on to page 19. This is a provision that appeared in the Senate budget, and it is section 90.2 NC Pre-K report on reallocation of unused slots. This requires the division to report to HHS Oversight and Fiscal on how unused slots are reallocated in the NC Pre-K program by March 1, 2026. On page 20, is your child care subsidy rates provision. This is a boilerplate provision, and it appears in the Senate budget. This sets forth the criteria used in implementing child care subsidy rates, including eligibility, co-payments for families, and other participation requirements. I do want to note a couple of things that follow the money decisions. One that mainly follows the money decision is subsection B. As my colleague Luke pointed out earlier, the current co-payment is at 10%. However, effective October 1, 2026, you'll see on lines 11 and 12, that is going to be changed to 7% to conform with the federal rule. One other thing I'd like to note in this provision is on page 21, subsection I. This sets the subsidy eligibility criteria for non-citizen families in this state, both legally and illegally. This revises eligibility criteria for non-citizens families in this state illegally to only apply to a child who is a U.S. citizen and otherwise eligible for subsidy. A child in CPS or developmentally delayed or at risk for such is no longer eligible for subsidy pursuant to this revision in the provision. On page 22, is the boilerplate provision that also appears in the Senate for the child care allocation formula. This sets forth the formula to be used in establishing the base amount for each county's child care subsidy allocation and paying the cost of child care for needy families. On page 24, this is another boilerplate provision that also appears in the Senate. This is your Smart Start Initiatives provision, and it sets forth the policies and requirements regarding the use of funds for Smart Start, including administration, salary schedules, match requirements, bidding practices, evaluation, and prohibitions on use of funds regarding capital expenditures and advertising activities. I'll make, again, one note, in subsection D, there's a clarifying change regarding the total match requirements. And then there's also a requirement that NCPC Smart Start submit a copy of the report to the Division of Child Development and Early Education. Moving on to page 27. This is another boilerplate provision that also appears in the Senate. This is the Smart Start Literacy Initiative, Dolly Parton's Imagination Library, and this provides is an early literacy program that provides age-appropriate books on a monthly basis to children. This has been slightly revised. You'll see in subsection C, it now has a reporting requirement for NCPC. That's going to be a biannual report at the end of, by December 1 of each even numbered year to HHS oversight. And the report will at a minimum include how the program impacts a child's reading skills and literacy development, the program's overall success regarding participation rates, book distribution, and community involvement, as well as an analysis of the program's long-term sustainability, including any recommendations for program improvement. Moving on to page 28. This is the provision that follows your money, and it's also in the Senate. It increases child care subsidy rate reimbursement rates. It's been slightly modified to begin October 1, 2025. That's a distinction from the Senate. On page, and I'm sorry, that the Senate had it beginning July 1, 2025. On page 29, this is a house-only provision, and this provision exempts certain Department of Defense family child care homes from child care licensure. It amends the laws related to child care facilities to exempt family child care homes operating in the state and located outside of a military installation from the state child care licensure requirements if the family child care home has a certificate issued by the U.S. Department of Defense or Coast Guard to provide child care, has completed background screening by the Department of Defense, and received a favorable suitability and fitness determination. These homes will be required to register with the division to ensure compliance with all DoD requirements and certification of various state safety provisions within the applicable dwelling unit. Moving on to page 31. This is another house-only provision, and it's based on House Bill 412, third edition. This is your child care regulatory reforms bill, and it makes various regulatory reforms in child care, including developing a proposed plan to separate QRIS, which which is the star rating system for child care subsidy, from child care subsidy. It makes changes regarding lead teacher responsibilities, revisions regarding out-of-school child care at elementary and middle schools for school-age children. It makes changes regarding staff-child ratios and capacity for child care facilities, qualifications for child care staff, specifically regarding the 5 years work experience equivalency for the NC Early Childhood credential. It requires establishing a work group to examine potential group liability insurance for child care providers, and authorizes the Child Care Commission to adopt or amend rules to ensure uniformity and consistency with the provisions of this section. That will take you over to page 37. This is a provision that follows the money, and it's house only again, and it's based on House Bill 542. My colleague Luke mentioned this earlier, and this provides funds, the $7.5 million in non-recurring funds to Smart Start to distribute to local partnerships to expand mental and behavioral health services for children, families, and staff in child care facility settings and out-of-school programs. And it also exempts these additional funds from certain administrative match and funding requirements, and establishes a Smart Start special fund in statute. Moving on to page 39, this is another provision that follows the money, and it's House only, and this is based on House Bill 389. It's titled the Child Care Workforce Pilot Program, and this program provides funds for a pilot program to develop and operate child workforce academies as in Johnston and Wayne, and that's continuing those programs and adding 10 additional counties through local partnerships. And this will be in collaboration with the Community Colleges System Office. And Mr. Chair, that completes the Division of Child Development and Early Education.
Allison Rossi, bill drafting. That brings us to the Division of Health Benefits, starting on page 41. This first provision continues the Medicaid annual report. It's a boilerplate provision and is identical to what appeared in the Senate budget. Page 42, this allows for volume purchase plans and single source procurement in Medicaid. Again, this is a boilerplate provision and is identical to what appeared in the Senate budget. Page 43 is another boilerplate provision that clarifies that consistent with the department's authority over the Medicaid program, the department is only required to maintain any modifications to the Medicaid program required by the budget through the end of the biennium. It also includes Section 15 of Session Law 2023-129, which had to do with reimbursements for dental procedures, which was the only modification that was passed outside of the budget. So just to bring that in line, this is identical to what appeared in the Senate budget as well. Page 44, administrative hearings funding provides for the transfer of funds to the Office of Administrative Hearings for mediation services and other contracted services related to Medicaid appeals. This is boilerplate and also is identical to what appears in the Senate budget. Page 45, accounting for Medicaid receivables as non-tax revenue. This is modified to reflect changes needed due to managed care. This is also boilerplate and is identical to what appeared in the Senate budget. Page 46, LME MCO intergovernmental transfers is again boilerplate, specifies the amount that each LME MCO must contribute through intergovernmental transfers rather than laying out a specific formula. It also provides DHB authority to make changes based on county alignments. Again, this is boilerplate and is identical to what appeared in the Senate budget. Page 47, Children and Family Specialty Plan. This just amends the beginning of the Children and Family Specialty Plan, which was originally supposed to be December 1st, 2024. That pushes that out to December 1st, 2025. It also makes certain changes to allow for a phased rollout that the department would like to do. This is identical to what appeared in the Senate budget as well. Page 48, this is Medicaid work requirements. This was based on House Bill 491 and is identical to that bill. This also appeared in the Senate budget. Page 49, temporarily extend option to decrease Medicaid enrollment burden on county departments of social services. It extends the temporary authority for the departments to use the federally facilitated marketplace to make these Medicaid eligibility determinations, which was set to expire June 30th of this year, pushes it out 3 years to June 30th, 2028. This was an agency request and appeared in the agency bill, which was House Bill 576. This also appeared in the Senate budget. Page 50, centralizing Medicaid eligibility study. This would require the department to submit a report examining basically the pros and cons of centralizing Medicaid eligibility determinations rather than having the departments, the county departments of social services do this. The report would be due April 1st, 2026. This is a House-only provision. Page 51, extend pharmacy reimbursement rates in Medicaid managed care. This appeared in your 2024 House budget. And extends the requirement for PHPs to pay pharmacy providers a rate for the ingredients cost for covered outpatient drugs and the professional drug dispensing fee at 100% of the Medicaid pharmacy fee for service rate. This was set to expire June 30th, 2026. This pushes that out additional 5 years to June 30th, 2031. And this also appeared in the Senate budget. Page 52, modify hospital health advancement assessments to remove gross premium tax offset component. This is related to what my colleague Mark Collins was talking about with removing that gross premiums kind of appropriation and having the Medicaid expansion be entirely supported by hospital assessments. This is just removing the gross premiums tax component from those assessments. Page 53, continue Medicaid coverage for pregnant women for 12 months postpartum. This coverage was originally temporary when the federal government allowed it. They have since made it permanent, so this would make it permanent in North Carolina as well. This is identical to what appeared in the Senate budget. Page 54, ensure Medicaid receipts for North Carolina HealthWorks implementation costs. This relates to one of the one-time hospital assessments that Mark Collins mentioned earlier. The same is true for page 55. This is that other one-time hospital assessment that appeared in the committee report. Page 56, Medicaid HASP reimbursement for psychiatric hospitals. This was House Bill 242 and would, again, just add freestanding psychiatric hospitals to the HASP program. That will bring us to page 62, Extend Primary Care Task Force. This was House Bill 629. And it just clarifies that the task force has the authority to collect health care spend data, extends them out to December 31st, 2026, and adds another report in April 1st of 2026 as well. The only change from when this was seen as House Bill 629 is it clarifies that the information that the task force collects can only be used for purposes of the task force. Page 64, this is your Medicaid standard plan contracts and prepaid health plan requirements. This, for the next round of standard benefit plan contracts, this would allow 4 statewide contracts, would require that one of those be awarded to a provider-led entity as long as one provider-led entity bids for one of these contracts and meets the minimum requirements. It would also add certain prior authorization requirements into PHP contracts. And would require the department to establish uniform provider credentialing criteria and require each PHP to comply with those criteria. The Senate had a version of this that is quite different, requiring 4 statewide contracts, 2 regional contracts, and an automatic award provision for provider-led entities for the 2 regional contracts. That brings us to page 67. Medicaid managed care cost containment. This would require the division to put into standard plan contracts capitation growth limits, annual reporting on cost containment efforts, actions that the division may take if the prepaid health plans fail to meet cost containment goals, and any additional cost reduction strategies. This is a House-only provision. Page 68, accreditation for Medicaid managed care entities. This would require the division to include in managed care contracts a requirement that managed care entities attain and maintain accreditation through an accrediting organization of their choice, but that has been approved by the department. I think at this time they are required to use the one credentialing agency that has been approved by the department. This is identical to what appeared in the Senate budget as well. Page 69, reducing use of inappropriate settings for delivery of behavioral health services. This provides for the expiration of a 2021 budget provision that required the department to request federal approval to add Medicaid coverage for services provided to beneficiaries who are in the hospital for at least 30 hours and are waiting to be discharged to a more appropriate setting for behavioral health services. The federal approval for that coverage was denied. So this would remove that requirement. Subsection B of this provision would require the department to report on its other recent efforts to address this issue of the inappropriate use of hospital settings for behavioral health services and put forward recommendations. This is identical as well to what appeared in the Senate budget. Page 70 defines sepsis in North Carolina Medicaid program. This would require the Medicaid program to use the most recently published American College of Chest Physicians Society of Critical Care Medicine sepsis guidelines when making any medical necessity or utilization review determinations related to the diagnosis, treatment, and management of sepsis. And this is a house-only provision. Page 71, this is your provision related to the discontinuation of Medicaid coverage of obesity management medications in Medicaid. Page 72, this is your provision related to those various increases, 3% increases in Medicaid rates that was mentioned in the committee report, including durable medical equipment and speech language therapy. Page 73, extend durable medical equipment rates in Medicaid managed care. This is related to the temporary floor that was set. This would extend that out to June 30th, 2031. Will require standard plans to pay a rate for durable medical equipment that is 100% of the lesser of the usual and customary rate and the maximum allowable Medicaid fee for service rate. Again, this was set to expire, but will now be pushed out to June 30th, 2031. This is a house-only provision. Page 74, adult care home Medicaid personal care services coverage. This was House Bill 485. And this requires the department to consult with stakeholders and submit a request for federal approval to provide Medicaid personal care services to individuals who reside in adult care homes or special care units and who have incomes above the threshold for eligibility for the state county special assistance program. And it must ensure that the cost of this new coverage is offset by any savings or cost avoidance and complies with all applicable legal requirements. And that completes the Division of Health Benefits.
On page 75 begins the Division of Health Service Regulation, Section 9F.1, charity care exemption for certain qualified urban ambulatory surgical facilities. This is exempting these types of facilities in counties with a population greater than 125,000 that were licensed prior to November 21, 2025 from the 4% charity care requirement and annual reporting requirements that are scheduled to take effect on November 21, 2025, These requirements were enacted as part of the Certificate of Need changes included in the Medicaid expansion bill, which exempted these types of facilities from review. On page 76, increase bed capacity for facilities licensed to provide a program of overnight respite services. This is a house-only provision that doubles the bed capacity for adult day care and adult day health facilities licensed to provide a program of overnight respite services from 6 beds to 12 beds. And that completes the Division of Health Service Regulation.
That brings us to the Division of Mental Health. On page 77, this is your boilerplate provision related to single stream funding. It does contain that $15 million reduction that was mentioned in the committee report and directs the department to allocate those between the LMEMCOs. It also requires that the LMEMCOs provide the same level of service utilization as compared to this current fiscal year. Page 78. This is the provision related to the repeal of that special fund that my colleague Luke McDonald mentioned, the Mental Health and Substance Use Task Force. It instructs the department to put the entire balance or up to $41.8 million towards single stream, and anything left in that fund will revert to the general fund. Page 79 is your boilerplate for local inpatient psychiatric beds or bed days, and this is identical to what appeared in the Senate budget.
Page 81, replacement for critical IT systems that support substance use disorder prevention and treatment. This provision follows money and is also identical to what appeared in the Senate budget. It's authorizing the Division of Mental Health to budget up to $1.2 million of mixed beverage tax receipts for each year of the fiscal biennium to fund implementation of a replacement project for outdated data systems supporting substance use prevention and treatment programs. Beginning in the fiscal year following project completion, the division is authorized to use up to $1.2 million of those mixed beverage tax receipts each fiscal year to cover operations and maintenance costs for the replacement system. On page 82, this provision follows your money for the opioid settlement funds. Sub A sets forth your definitions for the section. Subsections B and C repeal the prescription digital therapeutics pilot program that you all authorized in the 2022 budget that never commenced, and it directs the transfer of those funds allocated for the pilot program back to the opioid abatement reserve. Subsection D directs the transfer and appropriation of the opioid settlement funds for each year of the fiscal biennium to the Division of Mental Health for allocation as directed grants, as was described by my colleague, Luke McDonald. I will point out that there is language that specifies that of the directed grant funds allocated to the LME MCOs, the sum of $4 million shall be distributed equally among the LME MCOs, and they each have to spend $1 million to support opioid remediation efforts in Tier 1 and Tier 2 counties. Subsection E limits the use of these directed grant funds by non-state entities to opioid remediation activities within the state of North Carolina to respond to the negative impacts of the opioid epidemic. Subsection F requires non-state entities to report to the Division of Mental Health, HHS oversight, and the Fiscal Research Division on the use of their directed grant funds by September 1 of each year. Subsection G on page 83 establishes a timeline for disbursement of these directed grant funds in the event that the division is unable to begin disbursement of these funds as authorized by subsection D of this section within the time frame specified in the front of the budget bill due to the unavailability of settlement funds in the opioid abatement fund. Subsection H protects charitable, nonprofit, faith-based adult residential treatment facilities that are excluded from the licensure requirements of Chapter 122C from losing their deemed licensure status as a result of accepting state funding in the form of directed grants funded by these opioid settlement funds. And that completes the Division of Mental Health. On page 84 begins the Division of Public Health. Section 9H.1 is a boilerplate provision that also appears in the Senate budget. It sets forth the requirements, limitations, and reporting for this competitive grant program that awards funds to local health departments to improve maternal and child health in North Carolina. The provision amends the boilerplate to allow the Division of Public Health to award grants to local health departments for up to 3 years instead of the current 2-year term, and that can be found on line 25 of page 84. On page 86, section 9H.2, this provision requires the department to provide 6 months advance notice of its inability to operate the health insurance premium assistance program implemented within the AIDS drug assistance program on a cost-neutral basis, or in a manner that achieves savings, and this provision is identical to what appeared in the Senate. On page 87, this provision, 9H.3, follows your money. It's the increase to the medical examiner fee, taking it from $200 to $400 effective July 1, 2025. On page 88, section 9H.4, this is a provision that appeared originally in your 2024 budget. It directs the department to report to the Health and Human Services Oversight Committee on recommendations for a plan to establish maternal levels of care and to update neonatal levels of care to reduce maternal and infant mortality rates in North Carolina. The recommendations must be consistent with certain established guidelines, and the department must consult with specified stakeholders. On page 89, the Carolina Pregnancy Care Fellowship provision, this follows your money. It adjusts the allocations for this nonprofit organization as follows. You'll see in subsection A, $3.95 million must be used by this organization to provide grants to pregnancy centers for services. This is up from $2.9 million in your 2023 budget. $1 million is allocated to provide grants for durable medical equipment, and that's the same as what was provided in 2023. And then $1,050,000 is allocated to fund the Circle of Care Case Management Program. That's down from $2.1 million in 2023. And I'll just note that the $250,000 allocation in 2023 for educational training and resources regarding pregnancy has been cut. On page 90, additional funds for local health departments. This follows money. It's a House-only provision. It's just directing that an additional $2 million recurring for each year of the fiscal biennium be allocated equally among the local health departments, and it restricts that local health departments' use of these funds to activities authorized under the General Aid to Counties Agreement Addendum. On page 91, this is a House-only provision. It's based on House Bill 525. It is transferring the Rare Disease Advisory Council from UNC School of Medicine to the Department of Health and Human Services, and it makes other changes to the membership and duties of the council. I will note that it does not include the $250,000 recurring appropriation to cover the operating expenses of the Advisory Council on Rare Diseases that was included in House Bill 525. And that completes the Division of Public Health.
On page 94, this begins the Division of Social Services. The first provision is a boilerplate provision, and it's identical to the Senate. This is the TANF Benefit Implementation Plan, and it approves the temporary assistance for needy families, TANF state plan for fiscal years 2025 through 2028, and designates the electing counties. On page 95, this is another boilerplate provision that's identical to the Senate. Intensive Family Preservation Services funding, performance enhancements, and report. This sets forth the standards and reporting requirements for the Intensive Family Preservation Services program, which provides intensive services for children and families in abuse, neglect, dependency cases in an effort to reduce out-of-home placements. On page 96 is another boilerplate provision that's identical to the Senate regarding child caring institutions. This limits the maximum reimbursement rates for child caring institutions to the rate established by the department until the Social Services Commission adopts rules setting standardized rates. On page 97, another boilerplate provision that's identical to the Senate, use of foster care budget for guardianship assistance program. It allows DSS to continue to use existing funds available for foster care services for the guardianship assistance program, or GAP, which provides a monetary cash assistance payment. On page 98, another boilerplate provision that's identical to the Senate, Child Welfare Post-Secondary Support Program, otherwise known as NC REACH. This authorizes continued use of funds for support to support NC REACH, which provides assistance for educational needs of youth aging out of foster care, youth who exit foster care to a permanent home through GAP or the Guardianship Assistance Program, or special needs children adopted from foster care after age 12. Page 99 is a boilerplate provision, again identical to the Senate, regarding federal child support incentive payments. This requires the NC Child Support Services section of DSS to retain up to 15% of the annual federal incentive payments it receives to enhance centralized child support services, and allocate no less than 85% of annual federal incentive payments to county child support programs to improve effectiveness and efficiency using federal performance measures. On page 101 is a boilerplate provision identical to the Senate regarding your successful transition of foster care youth, also referred to as a Youth Villages program. This continues funding and support for transitional living services that demonstrate positive outcomes for youth ages 17 through 21 transitioning from foster care. Page 102, a boilerplate provision identical to the Senate, and it's a report on certain SNAP and TANF expenditures. It requires DSS to evaluate and report data regarding certain SNAP and TANF expenditures based on an analysis of data received from the vendor. On page 103, this is a boilerplate provision. It's identical to the Senate. Child Advocacy Center funds, and this is a provision that provides funds for the Children's Advocacy Centers of NC Inc. and requires a minimum of 75% of those funds be used for child advocacy centers across the state in good standing. On page 104, this is a provision that's identical to the Senate, and it requires the division, it requires status report on foster care trauma-informed assessment. If you recall, in the 2023 budget, there was money appropriated in each year, $750,000 in each year of the 2023-2025 biennium to the division to develop a trauma-informed standardized assessment and plan in all 100 counties for children who are at risk for entry into foster care or children currently in foster care who have experienced trauma warranting involvement with DSS or other child welfare agencies. This provision requires DSS to report to HHS Oversight and FRD on the status of the assessment by September 1, 2025, as that provision did not require a report, and every 6 months thereafter until the assessment is fully implemented statewide. And that concludes the Division of Social Services.
Now, on page 105, we have only one miscellaneous provision in Health and Human Services. This is a House-only provision, modification of certified nurse midwife requirements regarding written plans for the emergent and non-emergent transfer of patients planning births outside of a hospital setting. In North Carolina, CNMs who attend births outside of a hospital setting are required to have a detailed written plan for emergent and non-emergent patient transfers. The plan has to be provided to the patient, and it must include an informed consent agreement. This provision requires that each patient's written plan for transfer to a licensed healthcare facility include the name of and distance to the nearest healthcare facility that offers labor and delivery services and has at least one operating room that can be staffed 24 hours per day, and the names of physicians and practices that cover obstetric services at that facility. Under current law, there is no requirement that the written plan include facilities that offer labor and delivery services or a requirement to include the names of the doctors and practices that cover OBGYN services at the facility, or that the operating room be staffed 24 hours per day. And that concludes the miscellaneous section.
And Mr. Chair, there are two provisions that pertain to the block grants beginning on page 106. This is the provision that allocates the various block grants and shows the distribution of funds and provides requirements on the use of those funds for the various federal block grants for the 2025-2027 fiscal biennium. And this provision is boilerplate for the most part. It's been modified, and it follows the money decisions. And then the last provision on page 122, this provision follows the money, and it's been slightly modified from the Senate. This is use of child care and development block grant funds for a family child care home direct support pilot. As my colleague Luke mentioned, it allocates $3 million in each year of the 2025-2027 fiscal biennium from funds appropriated in the child care and development block grant for quality and availability initiatives to councils of government in the coastal plain, Piedmont, and mountain regions of the state for a 2-year pilot program to build child care capacity in those states. This differs from the Senate as it doesn't name specific counties. And Mr. Chair, that completes the report of special provision.
Are you sure you're done? I think Ms. Jones are going to go over the rules. You going to do that, Joyce? We'll have questions in a moment, but first I wanted to get the rules down. Thank you.
Yes, Mr. Chair. So if you'll turn to your rules for area committee procedures, the following rules will govern the eligibility of amendments to the proposed committee report and the special provisions. 1, money can only be adjusted among items within the same area committee section and not cause a change in another area committee's appropriations. 2, amendments where money is being transferred among items within an area committee must clearly identify the items or programs that are being increased and decreased. 3, non-recurring reductions cannot be made to fund recurring additions. 4, amendments that spend reversions or include shall not revert language are not allowed. 5, amendments that increase or create new management flexibility reserves are not allowed. 6, amendments that increase overall spending in the area committee budgets are not allowed. 7, amendments may not include fees or other finance-related matters. 8, amendments cannot reduce or eliminate vacant positions or their associated savings in the salary and benefits and agency budgets beyond what is already included in the area committee report. 9, amendments may not include Helene-related items. Helene items will be considered in a separate bill. 10, no amendment shall be in order unless the amendment is germane to the measure under consideration. 11, amendments that spend or otherwise adjust funds from the State Capital and Infrastructure Fund, State Emergency Response and Disaster Relief Fund, Lottery, ARPA Temporary Savings, SGEET Fund, other statewide reserves, or or the unappropriated general fund balance are not allowed.
Ms. Jones, are there any questions? Does anyone propose an amendment? Not today. I'm sorry, I didn't hear you. Is your mic on? I know you're trying to distract me, Representative Crawford, but I refuse to look at you and be distracted. Any amendments before us? I think we have a long one that you have the motion. It's in there. You took it.
Were you going to take any questions, Mr. Chair?
Once I ask for questions and we move on, I don't come back. That right, Representative Cunningham?
Yes, sir.
If you have a question, even though I did ask for questions, I'll let you respond, ask it.
Thank you, Mr. Chair. Just took me a minute because this is a lot to process, so I had to think about what my question was going to be. So I appreciate you
I look forward to
giving me a beat to do that. I have a couple questions, if that's okay, for staff, just to clarify a couple things since that was a lot and
Yes, ma'am.
processing a lot of
I
information.
was drinking out of a fire hose for sure.
Yes. My first question is on page 84 of the special provisions, the local health department competitive grant process. Can you point me to what the appropriation is for that grant program and how much it is?
Susie, you're recognized.
Yes, Mr. Chair. Representative Von Hafen, it's in the base budget, so it does not show up in the committee report. So if I could just have one moment to pull that up and confirm it. And if you want to ask another question in the meantime, if Mr.
Okay.
Chair
Ma'am, you're
allows that.
recognized.
Thank you. My other question is on page 848, the Medicaid work requirements. Can somebody just clarify, is this saying basically if the federal government requires work requirements, then we have to, or can you just clarify that?
Ms. Rossi, you're recognized.
Alice Rossi, bill drafting. Yes, this would require that if there's any indication that the federal government would approve work requirements, that CMS would approve them, not that the federal government would require them, that the Department of Health and Human Services would need to put forward a plan for including them in North Carolina's eligibility and submit that for approval.
Okay, just because, obviously there's discussion of that in the budget that's being discussed in Congress. So I'm just wondering how if they do require that in the federal government, that all states have work requirements, this is basically the language that would implement that here?
So the way that Jennifer Hillman actually may be a better person to answer, Mr. Chair, if you would.
Ms. Hillman, you're recognized.
Thank you, Jennifer Hillman, Legislative Analysis Division. So the provision actually amends language that was included in the Medicaid expansion legislation that was passed in 2023. So that legislation did require that if there's any indication at the federal level that work requirements would be approved, then the department is already directed under current law to move forward with implementing or seeking approval for the implementation of work requirements in North Carolina. So I think if the actions taken that have been proposed at the congressional level to actually require work requirements, that would certainly be an indication that work requirements would be approved. And so the language that's existing under current law would direct the department to go forward with seeking that approval for those work requirements. The provision provides additional authority for the implementation of those work requirements if they are approved.
Do you have the answer to Representative Von Hafen's question now?
Mr. Chair, yeah, I believe it's $2.5 million for the maternal and child health grants. Correct, recurring.
Representative Crawford.
Thank you, Mr. Chair. I appreciate being recognized. So I just have a couple of questions about the reductions in crisis services on C79 and the substance abuse treatment programs on C81, just to understand what the impact of those reductions.
There's less availability for the state this year, and not really the case that the federal government has decreased what's available. It's really just that we have less carry forward available, carry forward being unspent funds from prior year's allocations. So while it looks like a cut, it's really just that we've spent more carry forward in the current biennium than would be available next biennium. So it is a reduction in what's available. These are the areas that see most of the spending from those block grants. So kind of appropriately have received a commensurate decrease in the allocation. So it will be less money, less funds for example, adult and child mental health services, crisis services, but it's really reflecting what's available from these block grants, and does match across the biennium what was proposed in the governor's budget and included in the Senate budget.
Thank you.
Does the lady wish to follow up?
Not on that, but I have just two other clarifying questions.
Okay.
I did not see anywhere in here funding for Healthy Opportunities pilot, so I wanted to confirm that I didn't miss it. One, and then two, I did not see any funding for any innovations waiver slots, and wanted to confirm that I did not miss that either.
Mr. Collins, you're recognized, sir.
Yes, and Representative Crawford, you're correct on both accounts. No funding for Healthy Opportunities, no additional innovations waiver slots.
Representative Lameth, you're recognized.
I'm going to come back to the work requirement. We are very concerned about Medicaid cuts at the federal level, and so we're watching those very closely. I do believe that it is likely that they will authorize a work requirement, so we've been prepared for that. Our original Medicaid bill addressed that to some degree. We would have a fair amount of work to do to define what does that work requirement mean. Does that mean you're in school working towards a degree, that you're working how many hours a month? Those things still need to be worked out. But again, not only that one, but we're concerned about other cuts and watching those very closely. And we'll have, at some point, an update on what that might mean to the state and to the state budget.
Representative Cunningham.
Thank you, Mr. Chair. I'm on page 75. It's a Senate provision. And I was trying to figure out how did they come up with the 4%, which would have to be provided for charity care. It seems a little complicated in how they're coming to it. I guess staff can help me figure it out, but also the 125,000, if they were previously existing, then they would be exempted from the new legislation if it went in place. So it's a little bit complex. Can I get an understanding of, because most of the hospitals do 7% of charity care, and this new entity is only going to do 4%, and the population, of course, the population is an issue.
Ms. Jones, you're recognized.
Thank you, Mr. Chair. Representative Cunningham, the 4% charity care requirement was a policy decision. So I'm probably not the best person to speak to why it was set at 4%. However, I do want to point out this exemption for qualified urban ambulatory surgical facilities hasn't taken effect yet. It will take effect on November 21, 2025. And it was meant to exempt those larger areas of the state that have in place already ambulatory surgical facilities. The new term is qualified urban ambulatory surgical facilities, effective November 21, 2025. And these facilities will have to obtain licensure from the department. So the only thing that they're being exempt from is that charity care requirement and annual reporting requirements.
Thank you. Representative Servania.
Thank you, Chair. I'd like to ask a few content questions and then a procedural question to the chairs afterwards.
You're recognized for your question of substance and one of procedure, whichever you choose to do first.
Thank you, sir. In working with some of the divisions with DHHS, it was told to me that the division of tobacco and nicotine and also epidemiology were cut. I didn't see anything in the budget. Is this true?
Ms. Camilleri, you're recognized.
Thank you, Mr. Chair. Representative Servania, there are no cuts to state funding in the House budget. I'm not sure, the department might have been referring to federal funds that they have lost, but it's not in this budget.
Thank you. And so
you have a follow-up?
Yes, sir, follow-up.
Okay, you're recognized.
So we received a big number in some high-level federal funding cut numbers. Is there a document that you all are working within that is available to us to see detailed line items of what those federal funding cuts are? And can we receive them?
Thank you. You're recognized to respond.
Thank you, Mr. Chair. We do not currently have a document like that. We are working with the department, of course, to keep an eye on the cuts that are coming down from the federal level, and if any adjustments need to be made in the base budget during conference to account for those cuts, we'll work with the department on that, but we don't have anything at this time that would reflect it.
Okay, thank you very much. Follow up to you, sir. I wanted to understand our timeline when it comes to finalizing our budget. When is the committee accepting amendments towards the document, and when do we expect to finalize the whole budget process?
I will let Chairman Lambeth, who's the Senior Chair of Appropriations, respond to those.
We recognize that this is a very fast track, and there's a huge document that we all have to review. And so we're very sensitive to that. The challenge we've got is certainly the schedule and trying to get it all done next week. So from this point, and all the areas are meeting today, they all are doing similar work as we're doing here in this committee. At the conclusion of your questions, and if there are any amendments, you would vote it out, recommend it to the full floor. On Tuesday, there'll be a full appropriations. Finance will go at 9, and then appropriations, full appropriations, of which you are a member, would start at 10 o'clock. And In fact, I think finance may start at 8:30. That will give you, obviously, some chance to also make amendments if there are other things that come up. We're all going to obviously hear, now that this is becoming public, from a lot of people, good, bad, and ugly. So if there's things that you hear from, there'll be opportunities on Tuesday at the full appropriations to also propose amendments and let us look at those. The thought would be we would start voting out the budget on Wednesday and Thursday. If we need it, we'd have to be here Friday to clean up or do anything that's kind of hanging over. I know both caucuses will be having more detailed updates, whether that's Friday or Monday. I think there are plans to work on that. I think the staff's available and offer to meet with any of the groups that would like more specific updates. The big books, the ones that really do take a little time to go through, after we get through with these committees today, the staff will go away and incorporate any changes and then start finalizing those big books. I wished I could say that those would be ready Sunday, but it's probably realistically going to be Monday. Big books Monday, be online, and then we'll roll it from there. Frankly, it's been a challenging few weeks. We're trying to do crossover. We're trying to do budget. We went second this time. And to try to get the budget done on time and the crossover deadlines that we were up against, I would tell you, and I'll probably say this on the floor, is this 100% perfect? Nope. We got some work to do. We'll have some work to do in conference. And it really is important that if you've got not just amendments, but if you've got feedback for the full chairs, let us know what that is, because this is a step, but it is not the final budget. I wished, in some respect, I wish it was, because I do believe when you see the full package, it is a very strong, fiscally responsible plan. Are there cuts in here that I don't like? Absolutely, in other areas as well. But we're up against a really challenging time economically, with economy slowing down, and we just had to balance out a lot of priorities. And there are a lot of people that I think will be very excited about the House budget, because in my opinion, it is much better than the Senate budget. But there's also going to be areas we hear from that are going to be disappointed because they'd like to have seen a little bit more tweaking. And that's where, as you get feedback, feed that to us, because there's nothing finished yet. We certainly would like to minimize that. We certainly would like to get out of here, if we can, next Thursday. But we'll do what we have to do to try to have a very good product going into conference the 1st of June with the Senate.
Thank you. I'll recognize Representative Crawford in a minute. I just want to say the budget words travels quick. I've had 3 requests since I've been here to amend the budget from organizations, which is difficult to do. As I said at the outset, we had about a $20 million cut the first year and probably close to 50 the second year. That wasn't additions, that was cuts that we were required to make in the budget. So the chairs like what we had to do? Absolutely not. We liked it better when we had ARPA and COVID money and we could fund things, but we don't have that anymore. So as a consolation, I'll recognize Representative Crawford.
Thank you, Mr. Chair. Just one comment from my colleague at the end of my row here, and then a question.
Yes, ma'am.
Thank you, Representative Lambeth, for your comments about us providing feedback. We will be happy to do that, so I look forward to providing feedback to all of you. One quick question, and you may have answered it, Representative Potts. I was curious to know what the difference between the last biennial budget for HHS and this year, what those dollar amount differences or a percent cut is, if you have that available.
Mr. Collins, you're always ready with an answer for the last 2 hours, but we welcome your answer.
Yeah, I'm not quite ready with that answer, but that is something I could probably.
Okay, while you look that up, we'll recognize Representative Liu.
Thank you, Mr. Chair. The question is for page C18, And I'm just wondering the number of positions that this will eliminate for the Office of Health Equity and also for the vacant positions for DHHS.
Who would like to answer that? Mr. Collins?
Sure, I think, and Susie will correct me if I'm wrong, or Francisco will, the Office of Health Equity, is that 3 positions? And then the $10 million reduction for vacant positions, there's no specific number attached to that. That being said, I think when we looked at it, it's probably somewhere in the neighborhood of 200 or so positions.
Thank you. A quick follow-up.
Follow-up, you recognize.
Is there a requirement in terms of how long the positions need to be vacant? So they would be required to eliminate. Thank you.
Francisco, you're recognized, sir.
Thank you, Mr. Potts. Thank you, Representative Liu. So the 10 million in reduction to vacant positions, there's no specific requirements, so that does provide DHHS with the flexibility to decide, they can cut a vacant position that's been vacant for 3 months or 24 months. It's kind of up to them. The only real requirement, which is also in a provision, is that the vacant position cuts should not affect the Division of Aging, Division of Public Health, and the Division of State-Operated Healthcare Facilities. That's just with regards to that 10 million cut.
Representative Cunningham.
Thank you, Mr. Chair. I don't want to talk about the Office of Equity. The Office of Minority Health and Health Disparities, that budget has remained unchanged for a very long time. Have we done anything in that space at all? Even with the equity going away, the possibility of shifting.
Fernando, you're recognized.
Thank you, Representative Potts.
Francisco, I'm sorry.
No
I got a
worries.
friend named Fernando, so
No worries.
get you mixed up.
Representative Cunningham, so on page C18 of the committee report, the top there, item 24, that is eliminating the Office of Health Equity, which was previously known as the Office of Minority Health. There's no additional funds being provided to that office.
Follow up, Mr. Chair.
You're recognized.
So, because the Office of Equity went away, the Office of Minority Health and Health Disparities went away?
You're recognized, Francisco.
Thank you, Chairman Potts. That's correct, Representative Cunningham. So the Office of Health Equity was previously known as the Office of Minority Health. So think of it as the same thing. Current name is Office of Health Equity, and that is being eliminated.
Do you have the figure now for Representative Crawford?
I do, yes. And it might not be perfect because what I'm looking at is the base budget, the increase over the base budget. So this has a 4.6% increase over the base budget. So when Representative Potts, when Chairman Potts talked about reductions, those reductions were after some of the things that you have to do. For example, like the Medicaid rebase is $500 million. So the increase, you end up with an increase over the base budget. And there are some other things that were sort of must-dos as well. And then what was left is what Chairman Potts was referring to.
Thank you. Representative Von Hafen, it's good
May I
to
ask
see
one
your
other
hand
question?
again. Yes, ma'am, you're recognized.
Thank you. My question is on page C27, line 41, around the Nurse Family Partnership Program. Just want to understand this language about eliminates funding that is dispersed through local health departments. These funds will be reallocated to local health departments for activities authorized under this agreement. And then the line 42 that reduces the directed appropriation. So I'm just trying to understand Is the Nurse Family Partnership Program losing $2.5 million between those two line items?
Susie, you're recognized to respond.
Thank you. Thank you, Mr. Chair. Representative Von Hafen, that is correct. So Nurse Family Partnership receives funding through various different ways in the base budget. And so the first one, line 41, this is funds that go through local health departments to Nurse Family Partnership. And so that allocation is being eliminated, but in public health, there was that other item that reappropriated this $2 million directly to local health departments, and they can use it for any of the authorized activities under the agreement that they have with the state. And some may choose to keep sending it through to Nurse Family Partnership if that is what they want and need them for, but they have the flexibility to spend those funds now differently if that's the case. And so the organization also receives a $1.5 million general fund appropriation directly in the base budget. And so item 42 reduces that to $1 million. So now they're getting $1 million in the base budget.
Thank you. Any other questions? Not, the chair recognizes Chairman Reeder.
I would move to adopt the May 15th House Appropriations Committee on Health and Human Service proposed special provisions for Senate Bill 257 and the House Appropriations report on the base and expansion budget for Senate Bill 257, and move that staff be authorized to make any technical and conforming changes to these reports and the appropriate totals be adjusted accordingly.
Okay, you've heard the motion. I have a second by Representative Campbell. Any discussion? Hearing none, all in favor, aye. Any opposed likewise? The ayes have it. The budget is adopted and this meeting is adjourned.